Hi everybody, I'm Dr. Busybody, a board-certified internal medicine and pediatric physician here to bring you information and insight into common medical questions. Real quick disclaimer, I'm not here to give you specialized medical advice. For that, I would advise you to talk with your primary care doctor. Today's topic is about labs. No, not those labs. I'm talking about these kinds of labs with the test tubes, maybe you call them blood work or blood tests. These are the things that the doctor orders to determine the status of your health. Now, what do they actually entail? Let's talk about it. As patient portals are becoming more common and your blood test results are available to you on your phone, I want to make sure that you understand at least the basics of what you could find there. Here are just a few of the tests that your doc can order. We can talk about all of these in more detail in upcoming videos, but for today, let's just talk about the BMP. BMP stands for Basic Metabolic Panel. It includes information about your electrolytes and your kidney function. To talk about the electrolytes first, we gotta go back to the periodic table. Using the BMP, we can check for sodium levels in red, potassium levels in purple, chloride levels in green, and a combination of hydrogen, carbon, and oxygen in blue to equate to bicarb, or CO2, and glucose. You can also test for calcium levels with the BMP listed in yellow, not to mention all the other elements that we can potentially check for in your bloodstream. Oh, let's not go there. Okay, I'm focusing now. Let's go back to sodium, potassium, calcium, and glucose. Take a look at this diagram of a blood vessel with electrolytes flowing through it. The body tissues use up some of these electrolytes for energy and generating messages across cells. I'm not going to go into details about that, but it's a pretty cool system. Expect that if any of those electrolytes are too low or too high, then it's a cause for concern. This may result in certain symptoms that the doctor will ask you about. Warning, please don't panic. There's a few things that you need to know. 1. If you are not experiencing any symptoms, it's okay. The doctor will tell you about next steps. Number 2, lab tests will give you parameters for normal ranges. So if your test is off by only a couple points, no need to panic. And 3, every lab has different parameters for normal ranges. So comparing blood tests from different laboratories may not tell us anything valuable. This is why some doctors will insist on repeating blood tests to make absolute certain about the result. Now back to the BMP. Remember that it also tells us about our kidneys. Our kidneys are amazing organs. They help filter out toxins and unnecessary electrolytes in the bloodstream. So blood flows into the kidney and excretes out the unwanted things into the urine. In the BMP, there are 2 kidney numbers to look at, the creatinine, abbreviated CR, and GFR. Now, the creatinine is a product that is produced by your body and that is mostly excreted by the kidney. We use this number because when it is high in the blood, then that means that something's going on with the kidneys where they're not doing their job properly. It is non-specific because there are dozens of reasons why this could be happening, and it will be your doctor's job to figure out why. The kidneys can get, quote, irritated, as I like to say, even if you spend all day working at a computer and not drinking much water. So you could see a small increase in your creatinine by the end of the day. That's not a big deal, but like I said, it's your doctor's job to figure out if this is a dangerous increase or not. Last is the GFR. GFR stands for glomerular filtration rate. It's a fancy term to mean how well the kidney is filtering your blood. Let's be nerds for a couple seconds again. There are a few different formulas we can use to calculate the GFR. Don't worry about which one is the best, but just note that the GFR is dependent on the creatinine and age. So again, don't panic until you speak with your doctor. Alright, that's enough of us being nerds. I hope this video helped you understand your BMP a little more. Please understand that these tests are so nuanced that it's important that you speak to your doctor about any concerns you may have before jumping to conclusions. As always, please like, share, and subscribe if you liked this video. Comment below with any burning medical questions, and I will do my best to answer them in upcoming videos. Thank you and have a wonderful and healthy day.